Welcome to Olympian Water Testing, giving you the best in water analysis. Today, we are looking at mass.gov, arsenic in private well water. And as we know, arsenic is a naturally occurring contaminant in some groundwater and usually in bedrock aquifers, the central part of the state. Also, it is from different places, from bedrock wells, also called drilled or artisan wells, from shallow or dug wells, that can also contain arsenic. So where does it come from, and how can it affect your health? So arsenic, chemical symbol As, occurs naturally in soil and the bedrock parts, and during the 1800s, there was commercial arsenic mining in New Hampshire, but since 1985, arsenic used in the U.S. has been imported. Activities that could have left arsenic residuals include apple orchard spraying, coal ash disposal, and some use of pressure-treated wood. And the dangerous part about arsenic and a lot of heavy metals that are dangerous has no smell, taste, or color when dissolved in water, even in high concentrations, so only laboratory analysis can detect its presence and concentration. That's why it's very, very important to test your water for arsenic, because it could be filled with arsenic, but you wouldn't know, and you wouldn't taste it. Now, if you do drink water with arsenic, or if you're exposed to it, how can it affect your health? Well, arsenic ingestion can result in both chronic long-term and acute short-term health effects. And that can include nausea, vomiting, neurological effects such as numbness or burning sensations in the hands and feet, cardiovascular effects, decreased production of red and white blood cells, which may result in fatigue. Chronic effects can include changes in skin coloration, skin thickening, small corns like growths, especially on hands and feet. Chronic exposure to arsenic is also associated with the risk of skin, bladder, and lung cancer. There's also evidence that long-term exposure to arsenic can increase risk for kidney and prostate cancer. And the following factors determine the health risks: the concentration of arsenic in your water, the amount of water you consume each day, the length of time you've been consuming that water, your dietary intake of arsenic in the foods you eat, and the individual sensitivity to the arsenic. What is the regulatory standard for arsenic in drinking water? The current drinking water standard, or maximum contaminant level, MCL, from the U.S. Environmental Protection Agency is 0.010 milligrams a liter, or parts per million. This is equal to 10 g micrograms per liter, or 10 parts per billion. In 2001, the EPA reduced the MCL from 50 parts per billion to 10 parts per billion on the basis of bladder and lung cancer risks. Long-term exposure to drinking water containing arsenic at higher levels than 10 parts per billion increases the chances of getting cancer. For lower levels, the chances are less. If your water's arsenic levels above 10 parts per billion, you should get drinking water from another source or install a home treatment device. Levels above 10 parts per billion will increase the risk of long-term or chronic health problems. The higher level of the length of exposure, the greater the risk. And that's especially important to reduce arsenic water concentrations if you have children or are pregnant, or at greater risk of the greater water consumption on a per unit body weight basis. So that's some things to keep in mind, especially when it comes to arsenic and how to deal with it in private well water as well. That's why you should always periodically test your water for any level of arsenic.